On the day of your surgery, please arrive 2 hours before surgery. A patient registration representative will verify your information and explain the billing process to you. You will be asked to sign a condition of admission form, which allows the healthcare team to provide care, treatment, and services. Keep a copy for your records. If at any time you don't understand what your care team or doctor is explaining to you, please ask for clarification. You will be given an identification wristband to wear. Please keep it on at all times while you are in the hospital. Before surgery, you will be asked to sign the surgical procedure consent form. Your nurse will start an IV and get medical history and other information. Then you will be transported to the surgery department where you will be interviewed by the operating room nurse and anesthesiologist. Please be aware that the repetitive questions by multiple personnel are designed to ensure your safety. Before surgery, your surgeon will mark your surgical site. You will be asked to participate in this process by confirming the surgical location. We tailor your anesthesia to meet your personal needs. The anesthesiologists at Dominican Hospital are all board certified and board eligible physicians. The anesthesiologist will be in charge of your comfort before, during, and right after your surgery. He or she will manage vital functions in the operating room, such as heart functions, body temperature, breathing, and blood pressure, and will replace blood and other fluids if necessary. In the post-anesthesia unit, PACU, the anesthesiologist is supported by specially trained nurses to monitor you and ensure a safe recovery. The exact method of anesthesia will be determined by your surgery team and discussed with you. We will do everything we can to make the surgery process comfortable, but do not expect to be completely pain-free. At Dominican Hospital, pain control is a key part of your treatment. We will regularly assess and treat your pain so you do not have to endure or put up with severe pain. When pain is well controlled, you feel better, start moving and walking, and gain your strength back sooner. Communication is an important part of helping us manage your discomfort and pain. We encourage you to share information with your nurses about any pain you experience. Be as specific as possible. Where is the pain? How often do you feel pain? What does the pain feel like? For example, is it sharp or dull? Is it spreading? How do you rate your pain on a scale of 1 to 10? What helps to relieve the pain? At Dominican Hospital, multimodal pain management has become an important part of the perioperative care of patients undergoing total joint replacement. Our surgeons designed a comprehensive multimodal pain management protocol to maximize patient comfort while minimizing adverse effects from regional anesthesia and pain medications, and to promote accelerated post-operative rehabilitation. The principle of the multimodal therapy is to use interventions that target several different receptors of the pain pathway, allowing more effective pain control with fewer side effects. Opioids are given as a second-line treatment for breakthrough pain. Oxycodone is given for moderate to severe pain. Nursing care will ensure that patients receive oral pain medications 1 hour prior to therapy to minimize discomfort and disruptions. Please refer to page 22 in your Total Joint Care Program booklet for the list of medications you will be taking after your surgery. Please bear in mind that it is a generic list and is often tailored to the needs of individual patients. A common side effect of pain medicine is constipation. You will likely need stool softeners and laxatives while on strong pain medication. Tell us if you have not had a bowel movement. Also, tell your nurse or doctor if you are nauseated or have distressing symptoms such as shortness of breath, fatigue, or depression. Ask questions if you are worried. For example, many worry they might become hooked on pain medicine. Studies show people taking opioid medication for a medical reason usually do not become addicted. Following surgery, you will spend about 2 hours in the post-anesthesia care unit. An X-ray of a joint replacement will be taken as pain is controlled and vital signs are monitored. You will be transferred to the orthopedic unit where you will meet your joint care nurse. Your surgeon will visit each morning to assess your progress and clear you for the day's activities. Your nurse will be working with you throughout the day. During this time, the nurse will conduct general physical assessment, checking vital signs, circulation, motion, sensation, wound dressing, and mini wound vac if present. If a Foley catheter was inserted during surgery, it will be removed on the first morning following the surgery. Elastic stockings and sequential compression devices will be applied to both legs to prevent blood clots. The surgeon will place a waterproof dressing on the surgical site, and the nurse will check the integrity of the dressing frequently. You will receive antibiotics to prevent infection and intravenous fluids to keep you hydrated. The nurse will initiate a bowel regimen, including a stool softener. The nurse will review anticoagulants prescribed by the physician. During this time, you will be using an incentive spirometer every hour, while awake, to prevent pneumonia. This is a device that will expand your lungs by helping you to breathe more deeply and fully. Ice packs will be applied to your surgical site regularly to help manage swelling and pain. Your diet after surgery will be adjusted depending on your tolerance, and snacks will be offered. You will be able to eat a regular diet after your surgery. To help prevent constipation, eat plenty of fresh fruits and vegetables and drink several glasses of liquid daily. Please see page 34 and 36 of your Total Joint Care booklet for more information. You will receive continuous education on pain management, medications, diet, activity, treatment, precautions, incentive spirometer instructions, and anticoagulation teaching from your healthcare team. Our number one priority is your safety. Patients are often surprised how quickly they are able to get up and walk around. Unfortunately, this can lead to patients forgetting to call for assistance. While you are in the hospital, we ask that you always call for a staff member before you get out of bed. If we assist you into the bathroom, please do not attempt to go back to your bed or chair by yourself. Physical and occupational therapy is an absolute necessity for orthopedic patients. Getting up and walking helps prevent blood clots, pressure sores, pneumonia, and the formation of scar tissue. Physical therapy will help you get out of bed either the day of surgery or the first day after your surgery. Physical therapy is twice a day. The therapist will work with you on getting in and out of bed, standing up and down, walking, navigating stairs if needed, and exercises. The physical therapist will work with you to determine the appropriate assistive device to use during these activities. Occupational therapy will train you and your caregivers in activities of daily living, such as grooming and dressing. The occupational therapist will discuss your home setting and recommend any necessary equipment to make self-care easier. The occupational therapist will identify strategies to help with pain management and energy conservation during meaningful tasks. In addition to your ortho nurse navigator, each patient is assigned a care coordinator. The discharge plan created with your surgeon and his team is communicated to your entire joint team. If your plan changes, your ortho navigator or care coordinator will help to facilitate your new plan. We are honored that you are choosing and trusting the Dominican Hospital for your orthopedic care. We hope you find this information helpful, and we look forward to meeting you and delivering an exceptional experience.